Thank you so much. So we're happy to be here, and I'm happy and grateful to have Dr. Barasch with me to share what's really a hot topic right now, sleep and anxiety. So we started out, we thought we'd have, see how much you guys know about the topic. So we have some fun true or false questions. First is, more than half of Americans lose sleep due to stress or anxiety, true or false? Give you a moment to think about it. You don't have to answer, just think about it and we'll move on because we've got a lot to share. So the answer is false. Next, true or false? Can you force yourself to fall asleep? And the answer is false. Sleep is one of the few things that the harder you try, the less it'll come to you. You have to let it happen naturally. Next, everyone must have 8 hours of sleep every night to stay healthy. True or false? The answer is false. So 8 hours is the recommended, but it is, it won't be a catastrophe if you don't get your 8 hours. All right, so we're going to jump into some of the most common questions I think that patients ask about sleep and anxiety. So these are some questions I'm going to reserve. Actually, before we get into that, hang on, I'm sorry, Dr. Barasch, I'm going to steal the spotlight one more moment. Before we get into that, I want to acknowledge that sleep disturbances are a common response to stress, anxiety, and depression. I want to take a moment to recognize that many normal life events can cause our brains to go into overdrive, and we could find it difficult to wind down. And with all the challenges that we face, I just want to take a moment, remind everyone who's struggling to go easy on yourself. Many times there's just not enough hours in the day to get things done. And don't let fake lives on social media fool you. Just be patient and kind and forgiving to yourself. Give yourself wind down time to get closure to your day. Do something that brings you joy, or practice gratitude to help train your brain to reset at bedtime. And hopefully this talk will allow everybody to have to empower them to have a better night's sleep. All right, so now we'll get into the questions. All right, what can I do to manage my anxiety about bedtime?
This is not the first one. Go to the next.
Oh, I'm sorry. This is I'm still stealing that spotlight from you. All right. What can I do to manage my anxiety about bedtime? It's breaking the cycle is the most important thing. I wanted to highlight this slide because our negative thoughts kind of lead us down that rabbit hole or that tornado, and negative thoughts lead to negative emotions. Negative emotions lead to negative behavior and bad habits form. So breaking that cycle at any one of those blue arrows at any point in the chain will help. Cognitive techniques such as using gratitude, using positive self-talk. So like I said, I'm very grateful for Dr. Barasch to be our medical director and to be here with us. And even just saying that makes me feel better. So if you fill your head with positive thoughts and positive thinking, it will help you sleep better at night. Also, behaviorally making sure that the bedroom is set up for, a good environment for sleep, and making sure that you're, getting up at the same time every day, and having the right bedtime routine can also help. Okay, now we're going to get into the most common questions asked. Number one, what is the connection between anxiety and sleep?
Well, first, let me say good afternoon, everyone. It's Dr. Barasch, and welcome. I'm glad you could spend a little time this afternoon with us, and hopefully we'll be answering a lot of the questions for you. So this is the crux of the issue that we're going to be discussing. But as an introduction, let me say a few things about anxiety. Anxiety is a normal response that everyone has at certain times. It is part of our response to danger or stress. Anxiety works like an alarm, and it prepares the body and the brain to respond to a threat. We often refer to it as the fight or flight response, in which there's an increase in adrenaline, which leads to an increase in heart rate and breathing rate and blood pressure, at the same time as increased alertness. It would be very abnormal and potentially dangerous for someone to fall asleep or be sleepy when there's danger. So, as a natural response, sleep is inhibited in order to maintain maximum vigilance so that we can respond to a threat. Now, people with anxiety disorders, there is anxiety without any danger. So it's a false alarm. And people with anxiety frequently will have repeated false alarms with repeated or persistent arousals, which leads to difficulty sleeping. In fact, part of the defining criteria for anxiety disorders and post-traumatic stress disorder is the presence of disturbed sleep. And also conversely, among people with insomnia, about a third have anxiety. Next question.
I was trying to click that time. There we go. And I missed this one.
Back up one. Oh yeah, next slide.
There's our fight or flight. I'm going to get better as we go on. I'm a little out of practice. All right. How does the body's response to stress affect sleep?
So there are two major response systems to stress. One is called the sympathetic nervous system, in which adrenaline is released coming from a gland called the adrenal gland. And adrenaline is a very potent stimulator of the brain and the heart. So it'll lead to increased alertness as well as increased breathing rate and heart rate and blood pressure. And this inhibits sleep. In addition to that, we have a hormone cortisol, which is released, which especially happens with emotional distress or stress. And that further promotes wakefulness. Now, during sleep, it's the parasympathetic nervous system. This is kind of like the yin and the yang. The sympathetic nervous system alerts us, wakes us up, raises our blood pressure. The parasympathetic nervous system, which runs through acetylcholine, it does the opposite. It slows the heart rate and the breathing and promotes relaxation. And it's the parasympathetic nervous system that takes over as we fall asleep.
Okay. What kind of changes in sleep occur during prolonged stress?
So with stress, there tends to be less overall sleep, and especially less slow wave sleep, also known as delta sleep or deep sleep. And sometimes there's an increase in REM sleep, which can actually lead to more dreams and more nightmares. In patients with severe or prolonged trauma, such as occurs during wartime or occurred with the Holocaust, symptoms of PTSD are frequent. That's post-traumatic stress disorder. In a study of Holocaust survivors, 96% reported insomnia, and over 80% reported recurring nightmares.
Okay, what is generalized anxiety disorder and how is sleep affected by it?
So anxiety can be about a particular situation, such as right now during public speaking, or it may become generalized. In other words, not specific to any situation or not even aroused by any situation. It's like feeling fear when there's no obvious or present danger. Part of the anxiety response is increased arousal or alertness and therefore difficulty sleeping. Other symptoms of generalized anxiety include difficulty with concentrating, sweating, trembling, being very easily startled or feeling very nervous, and restlessness. But generally, a hallmark of this is people being hyper alert, which leads both to being easily startled, but also being unable to sleep.
What is the sleep like in someone who has generalized anxiety?
So as I mentioned, anxiety is associated with more sympathetic nervous system stimulation. In other words, more adrenaline as well as more cortisol, which leads to more arousals from sleep. So we test people, we see arousals or awakenings frequently, less total sleep time, and reduced slow wave sleep or deep sleep. And there's more fragmentation of the sleep. And then sometimes increased REM sleep. So there's more tendency towards having nightmares. About 60 to 70% of people with generalized anxiety disorder have insomnia. Unfortunately, people with anxiety also often develop bad habits, which Suzanne alluded to before, attempting to nap, resting often in bed while awake, or doing other activities in bed, like working or watching TV or being on a computer, or staying in bed for prolonged periods while awake at night, or going to bed early or staying in bed late. These are all bad habits that are behaviors that actually worsen sleep further, in part because they make the bed into a place that the mind associates with anxiety rather than with good sleep.
All right, next question. I'm glad that this is going on an upturn because this is a lot of bad news. So now this question is, how can sleep be improved in generalized anxiety disorder?
So in patients with general anxiety, their trouble sleeping generally responds very well to certain medications, particularly antidepressants, such as the SSRI or SNRI agents, or to sedative agents like the benzodiazepines, things like Valium and Xanax. Certain sleeping pills, especially those related to benzodiazepines, can be very helpful. Psychotherapy is often beneficial. In addition, a strategy that we call cognitive behavioral therapy can help improve sleep significantly. And finally, relaxation techniques can be helpful, such as progressive muscle relaxation, techniques to control breathing, or meditation.
What is the sleep like in someone with insomnia?
Well, as you might expect, people with insomnia often take a much longer time than normal to fall asleep. We call that initial insomnia. In addition, the sleep tends to be more in lighter stages. Sometimes it's mostly light sleep. People with insomnia have frequent or prolonged wake periods during the night. And sometimes they'll awaken early in the morning, earlier than they'd like to, and then they can't fall back to sleep. However, I do want to point out a very interesting thing that is that usually people with insomnia, when they're tested objectively in a sleep laboratory to actually evaluate their sleep, they actually sleep longer than they think they do, and sometimes a good deal more. Sometimes patients will say, I only sleep 10 or 20 minutes during the night, and we test them and actually recognize that they have 5 hours of sleep. This is something that we refer to as sleep state misperception. And it occurs partly because there's time distortion at night, also because there's often fragmented sleep with drifting in and out of sleep. And in light sleep, there can actually be some awareness, and therefore people can think they're awake, but they're actually asleep.
Very true. All right, next. What else might keep people up or wake people up at night?
So a lot of conditions can disturb sleep or keep people awake. That can include sleep apnea, restless legs, which is an uncomfortable, restless feeling in the legs, sometimes in the arms, an urge to move the legs that occurs at night. Some people have something called periodic limb movements, which is periodic jerking movements or twitching of the legs. Then, of course, people can have nightmares and wake up from that. And lastly, pain is a significant disturbance of sleep. And some people have difficulty breathing related to lung disease or heart disease, which will either keep people from falling asleep or wake them up.
Leads right into the next question. How is sleep different in someone with insomnia and anxiety from someone with sleep apnea?
So people with insomnia, they'll have difficulty falling asleep or they wake often at night and have difficulty falling back to sleep, sometimes for long periods of time. Once they fall asleep, their sleep actually may be relatively normal until they awaken again, usually spontaneously. So to some degree, the problem with insomnia is mostly really a wake problem. The problem is while you're awake, you can't fall asleep. The sleep itself is not that abnormal. We sometimes use the term hyperarousal to describe people with insomnia since they have difficulty sleeping whether it's day or night. People with sleep apnea, on the other hand, usually fall asleep fairly readily, but then they awaken frequently due to brief episodes of breathing interruption that we call apneas. They may actually awaken very frequently, but generally for just a short time. So each time they awaken, they fall back to sleep quickly until they have another arousal from another apnea. Now, often those awakenings or arousals are so brief that the arousal isn't even recalled. People with sleep apnea, because of all this disruption of their sleep, are usually sleepy during the daytime due to these disruptions in their sleep.
Okay, now what came first, the chicken or the egg? Can sleep help to calm an anxious person?
Well, yes, it can actually. Early in the night of sleep, there's usually an abundance of slow wave sleep or delta sleep or deep sleep, and it's during this time that cortisol release is actually inhibited, sympathetic activity, the fight or flight response is actually reduced, and there is a more relaxation. On the other hand, later in the night, there's more REM sleep and more sympathetic nervous activity, um, and that might tend to be less relaxing. But fortunately, early in the night when people first fall asleep, there is a strong relaxing effect. So this actually can calm someone who is anxious.
Beautiful. Love that picture too. What is panic disorder and how does it affect sleep?
Well, people with panic disorder frequently have very severe anxiety and agitation. And it's unpredictable because it's not related to any particular situation. When it occurs, people will have rapid heart rate and sweating and often trembling. Now, this may occur and often does at night. Now, since part of the panic is that there's a severe alerting, there's often sleep disturbance. 2/3 of people with panic disorder have difficulty sleeping, and 3/4 have restless and very disturbed sleep, particularly in the middle or later in the nighttime. Sleep studies usually show a delay in sleep onset and more time awake during the night in people with panic syndrome. Now, most people with panic disorder have nighttime attacks as well, but in about 20% of them, the episodes only occur at night, and they're characterized by actually waking up from sleep in a state of panic. That's referred to as nocturnal panic disorder. When sleep studies are performed in these people, the nocturnal panic usually comes out of stage 2 sleep. It's a middle level of sleep. Unlike nightmares, which occur in dreaming state, which is in REM sleep, or something else we'll talk about in a few minutes called night terrors, which occur in the deepest of sleep. People with nocturnal panic are thought to have an excessive amount of distress in any situation in which they fear they're losing vigilance or they have to lose vigilance, particularly sleep or relaxation.
Yeah, sleep is a very vulnerable state. So I could imagine that that's hard for these guys. So now the really hard question is, how is sleep and panic disorder treated?
So first, it's important that there be some evaluation to be sure there isn't a medical cause. Some medical causes could include hyperthyroidism, very high blood pressure, or arrhythmias, or it could be a sleep disorder like sleep apnea. Now, apart from reassurance, once medical conditions have been ruled out, panic disorder is usually treated with psychotherapy and antidepressants, and sometimes with sedatives like benzodiazepine medicines like Valium or Ativan or Xanax. Occasionally, people are treated with beta blockers, which will slow the sympathetic response, reduce the rapid heart rate and rapid blood pressure. Beta blockers are often used, for example, for stage fright, where people get panicky.
This is very close to home for me because my daughter's going through a lot of this right now. So the next question is, what is PTSD and how does it affect sleep?
So PTSD, as many of you know, is post-traumatic distress disorder, and it's a disorder that follows traumatic experiences. You can go to the next one, yeah. In people who have this, they often will have flashbacks where they sort of re-experience the trauma, and they have nightmares with especially recurrent, especially distressing dreams. And they often have difficulty sleeping because they have severe hypervigilance. Right, they're just constantly in battle mode, and this leads to severe insomnia. So people with PTSD have very prolonged what we call sleep latency, the time it takes till they fall asleep, often over 2 hours. And then they often report, in addition to that, that they're awake most of the night, or at least over half the night when they're in bed. However, interesting enough, objective studies usually don't show such reduced sleep time, as we will sometimes see with other kinds of insomnia, but it's very dramatic with the discrepancy with PTSD, with patients reporting that they sleep less than an hour and they actually sleep 6 or 7 hours. Now, in terms of treating it, PTSD is best treated with the combination of psychotherapy and antidepressants, especially the SSRI medicines. And sometimes the nightmares respond well, interestingly, to a medicine called prazosin, which is a blood pressure medicine that blocks the sympathetic nervous system. Recurrent nightmares respond to something called dream rehearsal therapy, which we'll talk about in a couple of minutes.
So again, this is close to home for me. So this next set of slides are my favorite because this is the moment. What can someone do to themselves or for their family members to lessen anxiety at night, which is preventing sleep?
So there's a number of strategies. The first is to limit or eliminate things that are further stimulating, like caffeine or other stimulants close to bedtime, and recognize that caffeine's present not only in coffee, but in tea and in cola. Chocolate has a caffeine-like effect. Consider having milk products which contain tryptophan, which is actually converted to serotonin, as well as to melatonin, and that may help sleep. The next thing would be to spend some time relaxing before going to bed. A little downtime before sleep is very important and helpful to calm the mind and the body. Now, when you're in bed, avoid watching the clock. That tends to promote more anxiety about not sleeping. Exercise is very helpful, as long as it's not just within an hour or two of bedtime, but exercise in the late afternoon or the early evening can help people to relax. It's good to listen to relaxing music or an audiobook, to something relaxing, or a podcast, as long as the subject is not anxiety provoking or stimulating. By the way, audio is always better than video, like TV or computers or smartphones, because the light in those things is stimulating. And finally, professional help with anti-anxiety medications will help sleep.
This is probably the most common question that I hear, and I'm glad that it was included here. And I there's about 1 million answers, but I love that you narrow it down when we went over this.
Right.
What can be done about racing mind or racing thoughts that occur at night?
So yeah, I agree. It's one of the most frequent things that I'm asked. And apart from medications, I have found patients benefit from 2 non-medication strategies. So the first is to make a worry list or a to-do list in the evening, generally like right after dinner. Sit down and make a list of the top 10 or so items that keep you awake at night or that kept you awake the night before. Actually write them down. But also next to them, right, what you can do or what you will do about them. So, you have a leaky roof, you're going to call a roofer. How are you going to solve those problems? Now, there'll be some items that may worry you that you can't do anything about, like global warming or, you know, the war in the Ukraine. Well, you're right that there's nothing I can do about that. And actually write down nothing that I can do about that. Then at night, when those racing thoughts return, you remind yourself that you've already dealt with those issues the best that you can when you were clear thinking and alert, and now it's nighttime is not the time to be thinking about them, and try to dismiss them. Having made that list actually helps people to dismiss these recurrent worries. Now, the second strategy, which can be used together with that, is to prepare yourself before going to bed or just at bedtime. Spend a moment thinking about what's the most pleasant thing you can think about, a person, a place, or a thing. Right? It could be a place you've had vacation. It could be somebody that you love. It could be something you love to do. And then when those racing thoughts begin and you remind yourself you've already dealt with them, you made your list and you still can't get it out of your mind, now focus on that most pleasant subject. And that combination works more often than it doesn't.
CBT has proven to be a very effective method to improve sleep for people with insomnia. What are some important aspects of cognitive behavioral therapy for insomnia?
So, yeah, CBT or cognitive behavioral therapy is something that we do employ a lot to help people who are having trouble sleeping. And what it involves is basically an attempt to channel the normal sleep drives towards producing sleep. So, normal sleep drive is powered by both a biologic need for sleep, which basically increases the longer you haven't slept, usually after 15 or 16 hours of being awake. And secondly, by the body's internal biological clock. Those are two mechanisms that we try to synchronize. So what cognitive behavioral therapy involves is first to avoid or limit napping during the day, which will reduce the drive to sleep because just like if you ate something before a meal, you lose your appetite for it. Having a very regular wake up time every day is very important. And I do recommend it be with an alarm. Now, I don't really care what time people make it. It's whatever time is your natural wake up time or whatever feels the most natural to you. That's the most important thing because that's time zero in your biological clock is the wake up time. Secondarily important is the bedtime. If you get up at the same time every day, what time you go to bed will determine how much sleep you get. Next would be avoiding excessive time in bed while awake. A lot of people make the mistake of just laying there for hours. So if you're not able to fall asleep after about 30 minutes, the recommended strategy in cognitive behavioral therapy is to actually get out of bed, but not to start activities, not to put lights on or stimulate yourself, but rather to sit in a chair, especially one close to the bed, and do something audio, listen to music or a podcast or an audiobook until you feel sleepy and then go back to sleep. That works better. Actually, people will fall back to sleep very often more quickly doing that than they will just laying in bed. So, why do we recommend this? Well, because spending a lot of time in bed when you're awake, and this is true in the day or at nighttime, what happens is it leads to a couple things. One is performance anxiety. You can't force yourself to fall asleep. Right? The harder you try, the more you can't. The other thing that happens is that if you spend a lot of time in bed awake at night or in the daytime, the bed itself will become associated in the mind with being awake and being anxious. And eventually the bed itself will promote anxiety and inhibit sleep. And lastly, the reason we say about a half an hour is that after about a half an hour, what actually happens, and this comes back to that sort of sleep state misperception, what actually happens is people are not fully awake anymore. They actually drift in and out of light sleep. But that light sleep isn't restful. It's not stable. It always goes back to being awake. But worst of all, that light sleep will inhibit sleep, deeper sleep. I call it the junk food of sleep. Just like if you had junk food before a meal, you lose your appetite. If you have light sleep that's not good quality sleep in the middle of the night, you lose your appetite for good deep sleep. Lastly, I want to just mention one other part of cognitive behavioral therapy. We call it cognitive because one of the elements is about thinking and about having opinions, which are not helpful to sleep. It's not a matter of whether they're right or wrong. It's a matter of whether they're helpful. That's all that really matters during the night. So things like, you know, I have to get 8 hours sleep every day or my day will be ruined, or, you know, I shouldn't wake up at night at all. Now, a lot of these things aren't even correct, but whether they're correct or not, they're not helpful to sleep, right? If you think not sleeping well is going to damage your health, that's not the kind of thing you want to be thinking about at night. True or not, it's not conducive to sleep. And so, you know, controlling these kind of negative thoughts, right? Other negative thoughts are people say, I'm a bad sleeper. Or one of the worst is catastrophizing, right, about not sleeping. You have to realize, you know, it's not the end of the world if you don't fall asleep right now. The real consequences of not sleeping well for a single night are relatively minor. And if you can accept that and sort of control these negative thoughts, they won't interfere with sleep as much. And again, it isn't always an issue about whether or not they are accurate or correct. It's a matter of what's helpful during the night. And, you know, sort of correcting that kind of thinking will improve sleep.
Thank you. All right, next question. What is the difference between nocturnal panic and night terrors?
So this is something that a lot of people get confused, confuse these two issues. So night terror is a good example of a child there. It actually occurs during the deepest stage of sleep, we call slow wave sleep. It's usually in children, although it sometimes persists in adults and occasionally reemerges in adulthood. And what it is a sudden arousal from sleep with loud screaming. It's often called like blood-curdling screaming and severe uncontrollable agitation. It can last from 5 minutes up to 30 or more minutes. Others in the household become extremely distressed. However, the person themselves, they're not awake. They're not aware. And they will have limited or no recollection of this whole thing later. So why is everybody so upset? They were carrying on for half an hour, screaming at the top of their lungs. That's very different than nocturnal panic. Nocturnal panic is a sudden awakening where you're fully awake from being asleep, fully alert, but a tremendous feeling of anxiety or fear of agitation. Someone who has nocturnal panic has a great deal of difficulty falling back to sleep, unlike the person who has the night terror, because they're very agitated, they're very hyper aroused. And unfortunately, they may actually dwell on it all day long the next day, and then they develop a fear of going to sleep or relaxing because they're afraid another episode is going to come back. So they may have similar names and they sound alike, but they're very, very different.
What are nightmares and how can they be treated?
So this is another thing that sometimes is thrown into the mix of night terrors and nighttime panic. Nightmare is something else. Nightmares, we also have the medical name is a dream anxiety attack. These occurred during sleep, and they occur in a stage that we call REM sleep or rapid eye movement sleep. And during REM sleep, the brain is actually quite active, but the body is asleep. But the brain is disconnected from reality. You're in a fantasy stage. Disturbing sleep dreams may occur, and they're more likely to occur when there's more anxiety, as I mentioned, because there may be more REM sleep, and there may be some carryover of that anxiety into your dreams. So a nightmare may wake somebody up and may lead to a brief period of anxiety after you wake up because it's troubling. Oh my God, all these terrible things happened. But then you realize that it was just a dream, and that anxiety is usually fairly short-lived. So it's usually anxiety that triggers the dream and not the other way around. I often hear patients will tell me that they think they're anxious because of all these terrible dreams that they have, and I explain to them it's usually the other way around. Because you're anxious, you're having these dreams. Now, most dreams are actually not recalled, especially if you go from REM sleep into another stage of sleep without waking up, or if if there's more sleep after the dream, or other dreams, they're not recalled. But even if they are recalled during the night or in the morning, dreams and nightmares usually are forgotten. They usually don't persist much later in the day, and by the next day, it's hard to even recall them. If somebody wanted to remember their dreams, and I don't usually recommend it, but if you really wanted to, if you write them down as soon as you wake up, then you'll be able to recall it. But it seems as if they're almost suppressed after a little while. One other thing that I want to mention about nightmares is that nightmares are very disturbing dreams. Um, can be triggered by certain medications, such as antihistamines, or beta blockers, steroids, and the medicines that are used for dementia, like Aricept. So one other thing to mention about nightmares and dreams is that if they are recurrent, there is a strategy that often works. I mentioned it earlier, and that's called dream rehearsal therapy. So if you remember the dream, especially if it's recurrent, you're dreaming the same troubling thing, every night. You dream somebody, breaks into your house, or you find yourself alone in an unfamiliar territory, and you get that same dream all the time. What works to suppress it is to think about that dream before going to bed, but imagine a different outcome. You're lost, but then you find your way. Someone breaks into your house, but the police come and take them away, and they're put away, and they never come back. Someone is chasing you. Imagine you get away, or somebody then takes them away. So you imagine a different outcome, and if you do that repeatedly, the recurrent dream will often go away, or it'll turn into a more benign dream. The last thing I want to mention about dreams is that sometimes initially, if a dream is very disturbing, people will wake up and they'll have trouble getting back to sleep. And, the best strategy is to use the strategy we talked about with cognitive behavioral therapy. Recognize it was just a dream. It has no connection with reality. There's no indication it's going to come true. And if you're not able to fall back to sleep, to remember the things that we talked about, get out of bed, sit in a chair, do something relaxing, listen to something audio until you feel sleepy, and then go back to bed.
I think this slide has provoked a lot of questions. We got a lot of questions about dreams coming in, so we're almost done. We'll get to some of these questions here shortly. All right, so the next one, I've tried everything and nothing worked. Now what? I've done all these things that Dr. Barasch has suggested, and I'm still struggling. So I'm gonna steal the thunder again for this one. I think if you're regularly experiencing sleep difficulty, whether it's difficulty falling asleep, difficulty staying asleep, if you're often tired during the day and it's not associated with an extra stressful situation or an unusual event in life that's causing you anxiety or stress, if it's like a regular thing and you're getting enough sleep at night, or if it's causing you to have a reduced ability to think or function or perform your daily activities, then those are all times to seek help. And not the sleeping hang on, not the sleeping doctor here, but the sleep doctor. There's board certified sleep specialists that do this for a living and really have the right answers, and there's not always an easy answer with sleep and anxiety. With, you know, a lot of the sleep disorders, there is a clear cut, here's the problem, here's the treatment. Sometimes, you know, there's a lot to explore. So these appointments are a little bit longer and they take some time, but they're worth going to talk to, you know, it's a consult with a doctor. It's worth having a consultation and talking to a doctor about, is this right for me? What treatments can I do? And where should I go from here? Having a consultation with a board certified sleep specialist is covered by insurance. So it's usually a specialist copay, but it's something that's readily available. So on that note, I thank you very much. We hope you sleep well. And we have Dr. Barasch's information here. We'll leave that up on the screen while we answer some of these questions.
Yeah, I can address some of the questions that have come in.
Oh, you see them? Okay, great.
Yeah, I can see them. So someone asked about sleep paralysis. I didn't mention that, but so sleep paralysis is a phenomenon where people wake up from sleep and they feel paralyzed. They can't move a muscle. And it's somewhat common. And what it is that part of REM sleep, when you're dreaming, is your body becomes paralyzed. That's protective, right? If you dream about a lot of movement, how come you don't move? Right? People who do move, there's an abnormality where people move when they're dreaming. They get hurt. They fall out of bed a lot. So to protect us, our body is paralyzed when we're in REM sleep. Now, sometimes things become discoordinated and we wake up and you're still feeling that paralysis from REM. It'll most likely arise from a dreaming state, but sometimes you don't remember the dream. Sometimes you do. And actually, sometimes people will wake up and not only feel paralyzed, but they still see the dream. Those two can occur together as well. That's called a hypnagogic hallucination. And it's actually led to a number of phenomena that we've seen, you know, over the millennium, of people who have imagined, you know, witches and demons that paralyze them and torture them. And in modern times, people have imagined, you know, an alien from outer space that comes into their room and injects them and paralyzes them and then does experiments on them. And that's that combination of sleep paralysis with a hypnagogic hallucination. So if it happens rarely, it's not an abnormal phenomenon. If it happens frequently, it could be an isolated issue, or it can occur in several sleep disorders. We see it more often in conditions where people wake up a lot. For example, people with sleep apnea will more often report sleep paralysis. It is part of narcolepsy. Narcolepsy is a triad of symptoms, and one of them is sleep paralysis, because people with narcolepsy have derangements of REM sleep. So it can be treated. It's usually harmless. If someone touches you, it will go away. Usually people will either fall back to sleep or they'll just fully wake up. It's kind of being stuck in between being awake and being asleep. You're still having some features of REM sleep while you're awake. And if you can relax, it will either go away or you'll fall back to sleep. But again, if it occurs very frequently, you know, it should be evaluated to see if there's other disorders. In extreme cases, it can be treated with medications. Let's see. So someone commented about sleep and age. If as we get older, we wake up more often, wake up 3 or 4 times to use the bathroom and able to go back to sleep. So that's true. Sleep is lighter. There are more awakenings as people get older, and it's not necessarily abnormal. By the way, it's not abnormal to wake up 4 or 5 times during the night. Most people are able to just fall back to sleep. They don't even recall it. Some studies have actually shown even more, 10 to 20 times during the night, but these are very brief, what we would call a microarousal, that can occur for no particular reason. What's abnormal is if they're recurring extremely frequently. People, for example, with sleep apnea, might have awakenings from apneas every minute or two. On the other side of it, what's abnormal is if you wake up and you're not able to fall back to sleep, then it's a form of what we call middle insomnia. And someone asked about, REM sleep and whether having longer REM periods will lead to anxiety. So REM sleep occurs more often in the second half of the night. It's generally in cycles. We go through different stages of sleep. In the first third to half of the night, very little REM sleep. And then as we get into later in the second half of the night, it increases and we get recurrent cycles. And initially, they might be short of 10 or 20 minutes, and then they get longer and longer. So some people will have longer REM periods, usually associated with prior sleep deprivation. So if you haven't slept well for a few nights and then you get a good night's sleep, you're more apt to have more REM sleep and therefore more dreaming. But the amount of REM sleep doesn't necessarily correlate with nightmares. They could be pleasant dreams. Nightmares will occur more often if there's more stress.
Someone asked here about reading before bed, and they said it works for me, and it's wonderful if something works for you. If it works for you, continue to do it. When we're trying to pick something to do before bed to help you wind down, doing something audible is usually better than doing something visual, because it's helping you shut the brain down. But if it works for you, then that's something that anything that works is a good thing.
Exactly right. When we give recommendations, we're talking about what works for most people. There's always exceptions, right? We generally, if somebody's having difficulty, we'll say try to minimize the light exposure. So if someone asked me what's the best thing to do, I usually would not say reading. I'd say listen to something audio. But if somebody says, reading has worked, then that's fine. Continue to do that.
There's a couple questions here about getting up to go to the bathroom at night. And one of the things that I know I see a lot in the sleep center is if somebody does have a sleep disorder, it's more likely for them to get up and use the bathroom frequently during the night, just because the sleep disorder is causing arousals or causing those awakenings. And if they're awake, their body says, let's empty out before you go back to sleep and fill up. So a lot of times, that's just a common occurrence that is associated with different sleep disorders, especially sleep apnea.
So somebody, go ahead.
I was going to say that there's a few questions about the use of melatonin.
Melatonin, tryptophan. Do you suggest any supplements?
Yeah, it's a complicated subject. I give a whole 2-hour lecture about melatonin. Our brains normally produce melatonin at night. It does help us to fall asleep, the natural melatonin in the brain. It's a very minute quantity. And that led to, all the research about whether exogenous, taking melatonin would be helpful. And after studying it for 40 or more years, the answer is still a question mark. And that's because the studies have been conflicting. Some studies show they help a little, some studies show it does not. Part of the problem with melatonin is that we don't, in spite of all that time, we don't really know how much or when to take it. And then to complicate things, the melatonin in the United States is not regulated by the FDA. It falls under the category of a food supplement, right? So people tend to think it's a vitamin, like vitamin M. It's not a vitamin. It's actually a hormone. And hormones can have unpredictable effects on the body. There are melatonin receptors in virtually every organ in the body. The only place that it helps or might help you sleep is the receptors in the brain. And those receptors that are elsewhere in the body could have unexpected side effects. Then there's the issue about, how much and when to take it. So it turns out that melatonin actually has 2 different effects on sleep. The first is a weak effect of making you a little sleepy. That's the part that people like to capitalize on. Now, it isn't necessarily true that the more you take, the more sleepy you're going to get. It just doesn't work that way with melatonin. We have receptors in the brain and they get saturated with a very small amount. So if melatonin is going to help, 1 milligram might be enough. 0.5 milligram might be enough. There's a point at which you'll saturate the receptors. The second thing that melatonin does is a little more complex, and that's its bigger effect, is that melatonin moves our biological clock. It moves it earlier. If you were to take melatonin at dinner time, it will tend to make your bedtime earlier, not because it made you sleepy. It shifted your biological clock, meaning that you're going to go to sleep earlier and get up earlier. So about a year ago, I got a call from my son who said, "Dad, I'm having trouble sleeping." I said, "You called the right person." So he said, "I know." He said, "I'm waking up early and I don't know why. I used to get up at 8 or 9 o'clock, sleep right till then. I didn't need an alarm. The alarm would go off, but I'd be waking up at the same time. Now I'm waking up at 5 o'clock in the morning and I can't fall back to sleep." I asked him, "What is he doing?" And he said, "Well, about a month ago, I started taking melatonin. I thought it would help me fall asleep." And I said, "What's happened is that melatonin has moved your clock so that now you're falling asleep earlier, which you think is good because, like the melatonin is really helping here, but it's making you wake up earlier too." So the problem is that melatonin does that, and it depends what effect it has on your biological clock is very complex. It depends on exactly when you take it. So we do know that in people who have a problem, we see this a lot in teenagers and people in their early 20s, where they're going to sleep really, really late, right? They're up late studying or partying or whatever they're doing, and they have a lot of light exposure that's keeping them up late. And now they can't fall asleep till 4 o'clock in the morning and they can't wake up until noon. Melatonin is really helpful there because we have them take melatonin 3 or 4 hours before the time we want them to go to sleep, and it moves their clock earlier. Now they're able to go to sleep at midnight instead of at 4 in the morning. And guess what? They wake up at 9 o'clock or 8 o'clock instead of at noon. So that's one use we do make of melatonin. It's really helpful there. A second use we make of melatonin is in people who have a condition called REM behavior disorder. Now, I alluded to this before about the sleep paralysis. So people, when they fall asleep and they go into REM sleep, they're paralyzed. They don't move. There is a disorder in which that doesn't happen. Right? People are not paralyzed when they're in REM sleep. Guess what happens? They fall out of bed a lot. They injure themselves. They injure their spouse. They act out their dreams. If they dream they're fighting, they get into fistfights. They dream they're running, their legs are moving. They dream they're bicycle riding, they're bicycle riding with their legs. They can get hurt. And for reasons we don't completely understand, melatonin stops it. And that's a good use of melatonin that we use. But coming back to the original question, which is melatonin help me sleep? The answer is I don't know, because we don't know. It seems to help some people, probably most people not. The reason we get conflicting results in studies is that it depends on who you're testing. And a lot of people who probably do get the response, it probably is because it moved their biological clock. People should understand that when sleeping medicines are tested, right, in order to get FDA approval, medicine have to be both safe and effective. So a lot of studies are done about safety, and then they're done about effectiveness. So when they test effectiveness, what they do is they compare it to placebo. And you'd think that when you test a sleeping pill against placebo, you get, wow, the sleeping pill helped 70% of people, placebo 0. And that's not at all what happens. What happens is placebo helps 50% of people. The medicine, 56%. FDA's impressed. 6% more people slept with the medicine than they did with placebo. We'll approve it. Now, I'm dramatizing it a bit. It may be a little more optimistic than that, but that's kind of how it works because placebo helps a lot of people. Now, I bring that back to melatonin. How many people does melatonin help? It's really just the placebo effect. That's true with sleeping pills. That's true with a lot of medications. But point is about melatonin, it doesn't do much better than placebo. That's what I'm driving at. So you're taking not a vitamin, even though it's sold with health food and vitamin, it's a hormone. You're taking a hormone that may have unpredictable effects and has a questionable benefit above placebo. That's why I generally don't recommend it, except for the situations that I described before, which are specific situations that melatonin is very well known to help with. Someone
Thank
asked about L-tryptophan, by the way, and basically L-tryptophan is a precursor to melatonin. It's basically like taking melatonin, but there have been terrible side effects with L-tryptophan, so we don't recommend it.
Dr. Barasch, thank you for answering that. I know it's 3 o'clock already, and we unfortunately won't be able to answer all the questions that everybody put in, but I just want to remind everybody that those that have asked about the slides in the presentation, it will be available at www.valleyhealth.com/tuneintohealth. Just keep checking that once the presentation's prepared, and it will be posted there. I think just to end, if you don't mind, Dr. Barasch, going over when should they see, I know Suzanne had mentioned it before, but maybe just to close, when should they see a sleep specialist?
So there are several situations. I don't think that I can kind of cover all of them, but if a problem is persistent, it's night after night, if it's severe, and probably most importantly, if there's daytime sleepiness. We get really concerned when people are sleepy in the daytime, right? That could lead to accidents, and it could be a symptom of serious problems such as sleep apnea. If there is persistent difficulty staying asleep at night, um, uh, that might be an indication of a sleep disorder. It may just be insomnia. I'm sorry that I said just, but I mean insomnia without there being an additional medical problem. But the longer these things go on, the harder they are to treat. When I see somebody who's had a sleep problem for 6 months, we're usually relatively quickly able to get it to resolve. When somebody comes and tells me they've had problems sleeping for 50 years, I tell them, it's been 50 years. We're not going to get this better in 1 or 2 sessions. It may take a long time. So, yeah, I mean, people have to, judge for themselves how severe is the problem. But as I said, if it's persistent, by persistent, we mean, more than a month or 2. We consider sleep problems to be chronic if it's 3 months. But persistent, severe, or if there's, sleepiness or inability to sleep at night. Otherwise, if it's something that might cause injuries, people who have movements during sleep that might get injured. We didn't have time to talk about sleepwalking, but the danger with sleepwalking is obvious, injuries. If you're sleeping when you're walking, you can walk into things. You can fall, you can get hurt falling downstairs or out of a window. So, if there's any kind of danger, it definitely needs to be evaluated. If you're falling asleep driving, I hate to give figures about how often, there are serious accidents. A lot of them make the news because of how spectacular they are. And ferries hit docks and trains hit train stations that are related to people falling asleep. Shouldn't have gotten that far. I've seen quite a few people who are pilots of airplanes and engineers on trains who are a danger to themselves and the public if they remain sleepy. So if you're in any kind of occupation that involves transportation where you're in charge of the vehicle, we don't want to leave those sleep disorders unaddressed. So that's some of the situations where people should definitely seek professional help.
Thank you so much, Dr. Barasch, and thank you so much, Suzanne, for your informative presentation this afternoon. At this time, I'd like to ask